Namaskar, myself Dr. VIPUL GURJAR. I am the professional head of the surgery in SBK's Medical College, Vadodara. Today I am going to discuss about the controversial topic that is use of Starr procedure in MIPH. The Starr procedure is invented by the Dr. Longo, and it is mainly invented for the obstructive defecation syndrome, in which there is a redundant mucosa, excessive redundant mucosa, which is creating the obstructive symptoms and the chronic constipation. But with the time going on, we come to know that the piles is not a primary disease, but it is always a hidden or non-hidden secondary disease of rectal prolapse. Either may be a small rectocyst, either may be a large rectocyst. What is MIPH? MIPH is the excisional pilopex, in which there is a strip of mucosa and a submucosa which is excised, and the prolapsing piles are repositioned. These prolapsing piles are the anal cushions. Okay. Sometimes, many cases, we are finding that after the MIPH also there is a prolapsing symptoms is persist. Second thing, recurrence is occurring, as well as there is a less regression of bile mass. Okay, right. Whenever there is a mild prolapsing piles, they are giving an excellent result in MIPH. But in a female patients, mostly they are associated old age female patient or the post multiparous patient, female patient are always associated with moderate rectocils. So whenever there is a large rectal mucosal prolapse is there, and there is a associated piles, if you are doing this MIPH alone, what happens? You are removing some limited amount of mucosa and a submucosal strip, approximately 1 each mucosa. But sometimes this mucosa, redundant mucosa, are more than that. So that's why this rectal prolapse, if you this rectal prolapse on table, you are feeling that this rectal process is reaching up to the outer border of CAD. In this case, MIPH will not sufficient. Okay, you can do with the swab test confirmation. If we are doing only MIPH, then what happens? This redundant mucosa further push over this staple line, and this cause more obstructive symptoms, because now there is a no distended tissue. There is the staple line, this which is a firm and hard. Now it is a mechanical one, and they are obstructing more. As well as the symptoms of piles also becomes further evident. And after the surgery, we always think of piles, but we are not thinking of a constipation problem, which is the main disease, or why the patient is coming to you. The patient is further coming back with the dissatisfaction for the evacuation problem. So in a case where there is a large rectal prolapse, you can do the Starr procedure instead of MIPS surgery. See, first thing, with this end of video, I am giving the confirmation by the innovator himself, Dr. Longo, that he used to do Starr procedure in 95% case nowadays for the pile surgery, as well as his complication or the complication rate of MIPH of recurrence, which is 6%, is decreased going to 1.3 to 1.2%. As well as all complication which are the common with the stricture formation is not happened in a Starr. There is a 0% of stricture formation in a Starr procedure. As well as I am giving, with the end of this video, I am giving the RCT, which is published for the Starr procedure for piles surgery, prolapsing pile surgery. So do that thing, go through it, and confirm this thing that the Starr procedure is also a very much indicative in a large prolapsing redundant pile mass. Thank you very much. Bye.